First human case of H5N1 infection was reported on Wednesday in a resident of Alberta who was reportedly feeling sick while flying back from a trip in China. The patient was hospitalized on January 1st and died 2 days later. The H5N1 virus is a highly pathogenic avian flu virus that spreads widely among birds. This avian virus rarely infects humans. Most human cases have been reported in people who had contact with sick or dead poultry infected with the virus. Symptoms of infection include fever and diarrhea, as well as coughing, shortness of breath, and acute respiratory distress. Unlike many other flus, H5N1 is not readily transmitted between humans. Since 2003, more than 600 human cases of H5N1 infection have been recorded around the globe. Around 60% of those infected have died. Canadian Health Minister Rona Ambrose said in a news conference on Wednesday that this recent H5N1 patient is likely to be an isolated case.